Welcome to the Dynamic Radiologist Podcast, where we feature leading experts in healthcare. And now, here's your host, Dr. Stephen Brownstein.
Dr. Brownstein here, host of the Dynamic Radiologist Podcast, where I feature top leaders in the health field and what they are doing to change the world. Past guests and organizations I've worked with include Rutgers, New Jersey Medical School, Newark Beth Israel Medical Center, National Pain Foundation, and many more. This episode is brought to you by Dynamic Medical Imaging that I started over 16 years ago. We are the leading experts in personal injury imaging, so if you or a loved one know of someone who has been in a car accident, work-related injury, or has slip and fall, give us a call. We have doctors from all over New Jersey refer their patients to us. What is really telling, though, is these same doctors come to us for their own imaging needs and send their family to us. I've been a board-certified radiologist for over 40 years. I've seen almost everything under the sun. Go to www.dynamicmedicalimaging.com, and for questions, go to the Contact Us page. The second sponsor is Spinal Kinetics, which we started over 10 years ago. We help medical providers of all specialties evaluate for the presence, location, and severity of spinal ligament injuries. If you do stress radiographs of any kind, then you can send them to our trained doctors who use our special technology. Spinal Kinetics developed a technology called CRMA, or Computerized Radiographic Mensuration Analysis, which is an advanced X-ray measurement technology to accurately measure the exact abnormal motion problems that occur with a spinal ligament injury. If you have any questions, go to www.thespinalkinetics.com or email support@thespinalkinetics.com. Today I have one of my close friends and one of the most recognizable doctors on TV, Dr. Donald DeFabio. Don, welcome.
Hey, thank you, Steve. I appreciate being on your show for a change, so thank you.
Oh, listen, reciprocity is always great. Don got his BA in Fine Arts at Trinity College. He graduated from New York Chiropractic College. He's board certified in chiropractic orthopedics and sports medicine. He's been practicing in Berkeley Heights for over 35 years. He's a volunteer for varsity athletics at Drew University. He's the lead classifier for international wheelchair and amputee sports medicine. And his hobbies, among others, is cooking. And you can see him cooking on his TV show. He hosts the Fabio Difference on public TV. He has produced over 50 videos. I stopped counting at 50 on YouTube. Some of the titles include Better Posture, Better Health, The Doctor and the Baker, Inflammation, Pain, and Nutrition, the 3 core exercises for runners, how to fix Achilles tendonitis, supportive taping for ankle sprain, fix your frozen shoulder for good, the 3 stages to metabolic detoxification, dieting and psoriasis, plantar fasciitis, tennis elbow exercises, and many more. Thank you. Don, how do you do all that?
You just get it done, Steve. It's time management, and we always seem to have the time for the things that are most important, and you just have to delegate that time. But when it comes to all the videos, I do them in bulk. What'll happen is I'll go to the studio and I'll film 2 or 3 shows. I'll take a afternoon in the office and I'll film 3 or 4 case studies. And then we just edit them over time and we release them over time. Because I'm up to 165 videos on my YouTube channel, 31,000 subscribers. And my plantar fasciitis video is the number 2 video on YouTube. It's got over 6.5 million hits.
That's amazing.
Yeah.
So what is the holistic approach to health and wellness?
It's drugless healthcare, Steve. It's the 5 factors of health. It's diet, and that could include supplements, but it's basically food. Food is a drug. It's rest, making sure you get enough rest, but also quality rest. And we know so much now about sleep hygiene, and we can track that. So it's getting good quality rest. It's exercise. I mean, the Cleveland Clinic came out in 2017 and said for mental health, you need an hour a day of physical activity. And that's a combination of flexibility, cardio, and strength. So it's exercise. It's a healthy mental attitude. All right. It's living in faith, not in fear. It's having a spiritual grounding, a spiritual basis as well. Prayer is part of that. And then there's chiropractic, because chiropractic stimulates the body to work better. I'm not saying we have all the answers, but it's holistic. If the body's functioning better, if the joints are moving better, if there's less pressure on the nerves, because the nerves control the rest of the body will function better. If it functions better, it'll be at a higher level of health, which, as defined by medical dictionary, Dorland's dictionary, is optimum physical, mental, and emotional well-being, not merely the absence of disease and infirmity. So a 1,000-foot view of holistic health are those 5 pillars. And that's how I treat my patients, with the 5 pillars of health. And depending on where your pillars are the weakest, that's where we give it the most attention. And that's how we kind of roll it out.
That's great. It's almost kind of in a business, they talk about the Power Parthenon, how you can't just support it like a diving board with just one pillar, because if something goes awry, so it's important that you have, as you say, all 5 pillars that are equally strong to support your well-being.
And that's a true holistic, whole body approach, is you balance those pillars as best as possible, as opposed to being reductionistic and saying, okay, you're a patient with low back pain, I'm just going to treat your lower back. And we're not going to look at the relationship to your ankles, knees, and hips, or to your upper body and your neck, to your lower back, or to your diet, or to the fact that you're not getting quality sleep, or you're under a lot of stress, et cetera, et cetera, et cetera. So it's that, the catchword for it. Now you're an editor of a medical journal. The catchword now is multimodal, right, Steve?
Right.
It's a multimodal approach to healthcare. That's the big catchword. Well, that's the holistic approach, is multimodal, doing all the different parts, integrating them to get maximum benefit for the patient.
No, I think that is extremely interesting, because the big movement now is medical integration. Or I did a podcast with Mike Carberry, Advanced Medical Integration, where they have multi-specialties under one roof.
Mm-hmm.
And but within that multi-specialty group, you still have to have the 5 pillars. The patient's still the same.
Exactly.
So all those areas have to be addressed, not just knee pain.
Mm-hmm.
And I think most of the models out there do not practice do not address the 5 pillars. They take one and that's what they do. And even these integrated practices, they focus on chronic pain. Well, how about acute pain? What happens if patient's in a motor vehicle accident? That's a whole, the patient's still the same. You have to approach it, but you have to have a protocol to work up those acute patients that may be different than your chronic protocol.
And it's looking at the whole patient. So you're exactly right, and unfortunately, everyone thinks about the automobile accident patient as the person who got injured. Well, what about the person who wasn't the victim? What about the other people that were involved? You know what I'm saying? They also got hurt. So we can't just look at it from an attorney perspective. It's about health perspective.
No, absolutely. So what's the DeFabio difference?
The DeFabio difference is, I listen. A patient was in the other day, and he'd been to several chiropractic doctors in the past. He's a senior citizen, and he goes, I just love coming here. I wouldn't go anywhere else. You guys are the best. I said, Steve, that was his name as well. Why? I mean, because I just do what I do. And he says, number one, you guys listen. You treat me as a person. You give me my options. You're current with all the research and everything. And I'm getting results that I've never gotten anywhere else. And, it sounds so simple, but that's just the way we do it. But the reason, in my opinion, healthcare becomes reductionistic, like you just said, is that's easy. That's a no-brainer approach. Everybody gets the same thing. You're a low back, we do this. You're a neck. We do this. You got headaches. We do this. I just do the big thumb. Big thumb. I just do your thumb, I don't do your pinky, and I do the thumb this way. It's easy. It's thoughtless. But when you're thoughtful and you listen and you engage with your patients, they respect that, they respond, and they don't get it anywhere else. And I think that's the difference. We're thorough and thoughtful, and we really listen and care. It's not a low back that we're treating. We're treating a patient with a low back. It's not their sports injury in their ankle or their headache. We're treating the patient who has headaches. What else is going on? And that's the best way I can quantify it. People are looking for, a couple of years ago when I was a little younger, I was called an old-time doctor, and I got a little taken back. But that's it. It's an old-time doctor. They come in, they sit down, they talk to you, you talk to them, you create a relationship, then you develop a treatment plan so they can get their goals. I don't have to agree with how my patients want to get there, but my job is to give them those choices, lay it all out, and say, all right, this is what we need to do. Let's get it done. And if they say, I'm not on board, I understand, and we agree to disagree.
Well, I think the two words that you mentioned that are most important is listen and results.
Mm-hmm.
And I think if patients know that doctors are truly listening or empathetic, I think they'll receive the information and retain it and act on it. Whereas, they did studies like 70% of what the doctor tells a patient, they forget once they walk out the door.
Mm-hmm.
And I think part of it is people can sense if the doctor is already thinking about the patient in the next room.
Yeah.
And that's a symptom of the system right now because it is based on numbers. Because reimbursement is so low that it becomes a volume business, and the patients suffer, and the doctors suffer because doctor's health suffers.
Yeah.
And go ahead.
No, you're exactly right. And as a sidebar, it really kind of two things that kind of one irks me, and one that is the DeFabio difference. What irks me is I got a check today from Blue Cross Blue Shield because they made too much money in 2019, and I was a subscriber of theirs, so they reimbursed me $600. On the other side, they keep diminishing reimbursement to doctors because we're making too much. Is that crazy? It's upside down. But when it comes to, people have to be consumers, and they have to realize that they should expect a doctor to listen, and they should expect to get results. And if they're not getting that, they should pick up their marbles and go somewhere else. And I'm essentially what we call an out-of-network doctor. I set my rates so that people can pay me whether they have insurance or not, and we're under the gun to get them where they want to be, and people respect that. And we have to get away from the insurance driving the care. So good point.
So how do you get from a bachelor's in fine arts to in front of the TV screen, the TV camera?
Well, the camera thing happened in 1999. Remember, I've had you on my show as a guest, and in 1999 I was on the Spotlight on Berkeley Heights as a guest, public access show, and the patient who produced and hosted it was retiring, was leaving the area, and she goes, "What am I going to do at the show?" I said, "I don't know. How hard is it? I'll take it over." And she calls me 2 hours later in the office and goes, "The show's yours." And that's how I started doing TV, local TV, public access. It was in 1999. And then I started going to events and interviewing people with my little video camera before it was Vogue, and people were doing it on their phones. And one day, I guess about 5-6 years ago, one of my daughters comes home from college. She goes, "Dad, you know you have 10,000 viewers on your YouTube channel?" And I said, "Oh, so?" you know? And she goes, "No, that's really good." And it was all very organic. I seem to come off well on camera. When I talk to people, it's like this, like you're very good at making me feel comfortable. And that's, so when you have guests, it's about that. And it's about sharing information. It's not about anything more than sharing information. And when people know that's what it's about, they're in the game. When they realize there isn't click now and you get, that turns people off.
No, and so how do you feel the YouTube and the filming, how you feel, how's it affected you as a person, as a doctor, as far as, you've done over 160, whatever.
Yeah.
But yet I feel that it to you, it's not a number. You have something more to tell your patients, the audience, that you want to get out, that you feel that you have a moral obligation to get it out and not keep it to yourself.
That's Steve. Thank you. You know me. That's the way I think. I'm an information guy. I like sharing information. I had a patient in yesterday, first time to the office, and they were, have you been to a chiropractic doctor before? He goes, "No, but I've looked at it on YouTube." And I said, "Have you been to my channel?" And he goes, "No." And I made him leave and go subscribe. No, I'm only kidding. But and he was watching the videos that were dramatic, that were show. And it wasn't about the patient, it was about the show. It was about the doctor and his show. And no, I have the video I posted the other night was a really cool case. It was a fencer, a high-level collegiate fencer, chronic toe pain, wasn't responding. And then we figured out the problem was her flexus hallucis longus was tight. Once we released her flexor hallucis longus and her hamstrings, it got rid of her big toe pain when she went up on her toes. And it was really cool. And I got all excited. And that's the tough stuff I share, just so people can realize you need to be thoughtful in your approach as a clinician and as a patient to just, there's information out there. So I'm doing a blend of clinical rounds for doctors and then just simple things for patients to learn about lifestyle and wellness.
That's great. So, if you had a newbie chiropractic graduate, and what 3 pieces of advice would you give them?
Yeah. First of all, work on these. Work on your hands. Work on being able to assess and treat with you got to have good manual skills. All right. Because you got to get the job done. So number 1, develop really good manual skills with your hands. Number 2, listen to your patient, take that history, spend the time to really delve into all of those questions. And then number 3, be thoughtful. Be thoughtful. Every time a patient comes in my office, I assess them, I treat them, and then I reassess them. So I know the benefit of that procedure, that treatment, that adjustment, exercise, whatever we did. I know how it changed on that patient. And by doing that with every patient on every encounter, you develop a database. And that database gives you an idea of knowing what to expect and how things should respond. And if you're thoughtful on a visit by visit basis, then you'll have better clinical outcome and better clinical skills. So those are the 3 things I'd recommend in that order.
If one of your relatives was out of town and hurt themselves, what would you tell them how to determine which chiropractic to go to? So
you look for the first thing you do is you look for a doc that's board certified in either sports or orthopedics or rehab, neurology, and extra certification. See, in chiropractic, it's a little bit different. When you get board certification, it doesn't change our scope of practice. See, in medicine, if you get a hand fellowship, you can work on hands, right? It works kind of like that. But if you don't have that extra fellowship, you can only go so far. But in chiropractic, the only reason to take board certification is to gain knowledge. So look for a doc that's board certified, because that means they want to learn more. And if they want to learn more, that means they're interested in outcomes. So that's the first thing I tell them to look for. And then after that, you go to their YouTube channel or their Facebook or their website, and you see, what are they about? Are they about the patient? Are they about, these are the, you know, is it a, for lack of a better word, a professional looking, you know, website? Or is it more, you know, a crash and burn website, meaning they're trying to get the new person and the new person and the new person, and always looking for the new person, the enticement. Over half of the people that come into our office with new conditions have been here before. You know, so we're into that relationship, and when they have a problem, they come back, they get better. When they have a new problem, they come back. So I'm not out there promoting enticements on my website, because my patients come here because they want to get better, not because they're getting a free something or a special deal. Although they do get a t-shirt when they come.
So anything else you want to discuss, tell the audience that you think they should know about chiropractic, about, you know, preeminent marketing by, you know, using video as a media to get your message and match the message to the right market?
You know, I've always had a affinity towards video. Like I said, I've been doing it since 1999. I'm comfortable in front of the camera, so for me, it works really well. You know, and I'm a one and done guy. I mean, I film live to tape, and it's great. It works really well for me. But people who aren't maybe that comfortable, don't worry about it. There's lots of great editing techniques. Um, and it's okay not to be perfect when you're doing your videos, all right? You have to come off as a person, as a real, relatable. You know, if it's too clean and too tight, you know, people may not, you know, get a feeling for who you are. So it works for me. If it isn't as comfortable for other people, I mean, there's so many other media out there. You know, there's blogging, which works really well. So if you're a better writer, you know, go into blogging. You know, so if you want to keep it short, you know, you do Instagram or Facebook and just use still pictures. So it's really about where you feel comfortable, number one. And number two, it's sharing information. People today like to be informed, in my opinion, and you inform them and you tell them who you are and be truthful. That's going to attract those types of patients. Okay. So you put out what you want to attract.
Absolutely. You know, it's interesting you mentioned 50% of your patients are self-referred back.
They're coming back.
In our center, about a third of our patients are repeat patients.
Yeah.
And another third come because the uniqueness of the machine, you know, claustrophobic and really challenged patients.
Yeah.
And we started asking the ultimate question on a scale of 1 to 10, how likely are you to refer your family friends to us? And it's amazing. We asked about the front desk, the tech, you know, techs, and the overall experience. I didn't realize how great my staff was, because we never really measured it.
Yeah.
You know, we only looked at the problems instead of the successes. And we're also doing you know, patient consents, the video testimonials, and you know, it's you know, and I'm sending out postcards, you know, thanking people for being here, that, you know, and thanking them for thanking us, you know, and it's just so satisfying. And I sign off proud owner of DMI, and you're the same way. You know, when a patient leaves you better, That's why you went to school. That's why you spent all this time and all the sacrifices that we both made to help patients. We're not here, the money, it's business, but at the end of the day, it's how many people have we helped and how many people know about us because we've helped those people. And I think referring patient is the best patient.
Yeah.
You have a greater ability to build trust with them. If you had other business, they buy more often, and they refer people to you. So we're like-minded in trying to do the best by the patient. And, it's really been an honor to have you on the podcast. You're a close friend, and more importantly, you're a great doctor and a great human being. And I truly appreciate your time that you spent today with us.
Well, thank you, Steve, and right back at you. And Rita Mills, a patient was just into your place for a follow-up visit. And again, accolades, and she really liked how she could lean back a little bit this time to make her more comfortable. So keep up the good work on your part as well.
Okay, thanks, buddy.
Hey, it was good talking to you. Anytime.
Okay, buddy. I'll talk to you later.
Sounds good. Bye now.
Thanks for tuning in to the Dynamic Radiologist Podcast. Make sure to click subscribe to get updates on our latest episodes.